Thank you guys for coming today. My name is Timothy Boswell. This is for my Speech 101. Dealing with pain is never easy. So here, let me offer you this. Opiates, painkillers, things that we deal with in our everyday life when dealing with pain. Opiates are a common drug prescribed to patients who suffer with all sorts of medical conditions, disabilities, or chronic pain resulting from wear and tear of various lifestyles. However, are these drugs causing you more problems than they are benefits? Today I'm here to talk to you guys about how painkillers are not the solution and how there are other means to help you. I know this firsthand because over the years I've witnessed through actions that painkillers are not the best solution. The JFK survey firm asked a group of individuals to rate the severity of several causes of death. They rated painkillers to be on par with alcohol abuse, smoking, tobacco use, mental illness, and gun violence, but less serious than cancer, obesity, heart disease, illegal drug abuse, and diabetes, and more serious than HIV and motor vehicle accidents. This to me is insane. Most of these people believe this because of not lacking intelligence, but lacking knowledge. People believe that painkillers and other things are not the actual issue, but they are. I'd like to explain the risk of opiates today, 2 alternate methods I found, and what is stopping us from using these alternative methods. Now that we have addressed the issue, let's dive into the world of painkillers. As I stated earlier from the JFK survey, painkillers lay in the middle of the spectrum. People know opiates are the problem. What people don't know is how they became a problem. That's why most people don't understand the dangers of painkillers or those who have used them and suffered through the withdrawals and witnessed it through their family and friends. Doctors have tried addressing these withdrawals with medication to help the relapse. Harvard Mental Health Letter 2011, the 2 most common used medication, methadone and bupropion, such a hard word to pronounce, can be used during both detoxification and maintenance therapy. These drugs only help keep withdrawals symptoms at bay, although they come with their own risks and problems of misuse. This is why there is a need to find something other than opiates to use on patients. One of the many alternatives to painkillers that physicians are starting to begin using is cannabis, possibly because medical providers have noticed for some time now that patients have been using cannabis to help with their pain on their own. Simon Haritainen, chief of clinical research at Washington University Pain Center, worked on a project that followed a group of 176 chronic pain patients in Israel over 7 months and found that 44% of them stopped taking prescription opiates within 7 months of starting medical trials. There have been other studies that showed also promising results similar to what he had done. However, cannabis does come at its own problems. The drawback to cannabis is that it cannot help with more realistic problems. If you break a bone or anything like that, cannabis does not help with such problems with chronic pain. The other solution to dealing with some of these is your normal therapy, physical therapy, occupational therapy, things like that. There are several different therapies for treating pain, all of which can be considered at one of 2 generalization groups, manipulation and simulation. Both of these types are described in physical-oriented therapies for self-management of chronic pain symptoms. Manipulation of the body tissue, muscles, bones, and hands or equipment to improve health and circulation, relieve fatigue, and promote healing. Stimulation, which includes therapies that electric stimulation of nerves or muscles, passages of current into the body, or using the interrupted current of low intensities to raise the threshold of skin to pain in treatment without the generalization of perceptible heat. Therapies, however, are a much less reliable solution at the current moment. This mainly has to do with affordability and other problems, such as if someone goes in and gets treated, there is a chance that it's not 100% they will heal from it. There have been instances where therapy didn't help at all, and in some cases even caused the patient more pain. Therapy is a great way to help reduce the overall need for painkillers. If promoted in conjunction with other alternatives like cannabis, there is a possibility that we could get rid of painkillers altogether. Opiates need to be done away with, or at least reduced exponentially, to stop the current growth of misuse of opiates. They have plagued too many and caused more harm than good overall. There needs to be an alternative to opiates. Will you stand by, allow opiates to continue plaguing the good people of this country? It's time for a change, a step in a different direction, away from painkillers we've allowed into our medical system. Though with so many boundaries, there must be a change to help make this alternative treatment more affordable and more accessible. It is up to us, the people, to change this. Thank you so much for listening, and I hope you all have a wonderful day.